Hi, my name is Associate Professor Dr. Chantacha Sitticharoon, and I am the corresponding author of this study. I currently serve as Assistant Dean of Undergraduate Education and Vice Chair of Academic Services in the Department of Physiology, Faculty of Medicine, Sitticharoon Hospital, Mahidol University, Thailand.
Hi, my name is Issarawan Keadkraichaiwat, the first author of this study, and I work as a research officer. We recently published our article titled Influence of Admission Pathways on Learning Strategies, Assessment Engagement, and Academic Performance among first-year medical students in JMIR Medical Education.
In 2021, our medical school introduced a major curriculum reform. We clearly defined course learning outcomes, shifted from a compensatory to a non-compensatory evaluation, and replaced traditional A2F grading with a non-grading system as outstanding, satisfactory, and unsatisfactory. Students were also allowed multiple attempts when completing course learning outcome assessments to achieve the required outcomes.
In the same years, students were admitted through different pathways under the Thai University Central Admission System, including academic, quota, test-based, and rural tracks. These pathways are designed to bring in students with diverse backgrounds and strengths.
In this study, we aimed to compare students' self-regulated learning strategies, their engagement with assessments, their preferences toward the non-grading system, and their academic performance across these different admission groups. We also examine how these factors are related and identify what contributes to academic performance in each group.
We include all first-year medical students from the 2021 cohort with a total of 319 students across the four admission pathways. Most students were between 19 and 24 years old, and slightly more than half were male.
We collected academic data from institutional databases, including assessment engagement statistics, course learning outcome scores, and overall summative scores. We also used two built-in questionnaires, one on self-regulated learning strategies and another on students' preferences for the outstanding, satisfactory, and satisfactory system, both of which has very high response rates.
When we compared the groups, we found that students from the academic pathway show higher levels of goal setting and enthusiasm, along with lower stress during their studies. In contrast, students from the rural pathway reported higher stress before examinations.
Most students in the academic, quota, and test groups prefer the outstanding, satisfactory, and satisfactory system, while students in the rural group tended to prefer a simple satisfactory and satisfactory approach.
In terms of academic outcomes, the academic group achieved higher score overall. Interestingly, they required fewer attempts and had fewer first part or higher score attempts. On the other hand, the rural group had lower scores and needed more attempts to pass the learning outcomes.
When we look at relationships between variables, we found that higher summative scores were associated with better course learning outcome scores and more successful attempts, while they were negatively associated with first part attempts.
Further analysis showed that academic performance was positively influenced by consistent passing across learning outcomes and overall performance, but negatively influenced by relying on first part or single high score attempts.
Overall, our findings show that admission pathways play an important role in shaping how students learn and how they engage with assessments and how they perform academically.
This study is unique because it integrates learning strategies, assessment engagement, and academic performance within the same cohort. It provides evidence on how admission systems may influence learning behaviors and academic trajectories.
Importantly, this finding can be applied in real-world settings, such as designing more inclusive curricula, identifying at-risk students early, and implementing targeted support strategies like monitoring and self-regulated learning interventions, while also balancing academic rigor with students' psychological well-being.
We choose to submit our research to JMIR publications because of its strong reputation in medical education research and its commitment to open access dissemination, allowing our work to reach a global audience of educators, researchers, and clinicians. It also has a high impact factor and is one of the leading journals in the field. Thank
Thank
you
you
very
very
much.
much.